The emotional and psychological dimensions of consulting AI about health concerns deserve attention that goes beyond the technical questions of accuracy and privacy. There are genuine psychological benefits to AI health consultations, but also risks that are less obvious than the medical accuracy concerns we've discussed previously. The non-judgmental quality of AI is perhaps its most psychologically valuable feature. Human healthcare providers, despite their professionalism, are still humans who might react with surprise, disgust, or moral judgment to certain disclosures. Patients pick up on these reactions, even subtle ones, and it affects what they're willing to share. AI doesn't judge, doesn't visibly react, and treats every disclosure with the same neutral tone. This creates psychological safety for discussing embarrassing symptoms, stigmatized conditions, or behaviors that might elicit criticism. For conditions carrying particular social stigma, mental health struggles, sexual health concerns, substance use, certain physical symptoms, this non-judgmental space can be transformative. People who've delayed seeking help due to shame or embarrassment might consult AI as a first step, getting information and potentially enough reassurance to eventually seek human medical care. The AI serves as a stepping stone that makes later human consultation easier. The 24/7 availability addresses anxiety in ways that scheduled medical care cannot. Health anxiety often peaks at inconvenient times, late at night, weekends, during periods when accessing providers is difficult. Being able to immediately voice concerns and receive responses, even if they're not perfect medical advice, can provide meaningful anxiety relief. The simple act of articulating concerns and having them acknowledged can be psychologically soothing. The absence of time pressure in AI consultations allows more thorough exploration than typical medical appointments. You can ask follow-up questions, explore tangential concerns, and take time processing information without feeling like you're wasting an expensive doctor's time. This unhurried quality can help people better understand their health situations and formulate questions for eventual human consultations. However, these psychological benefits come with significant psychological risks that deserve serious consideration. The development of dependency on AI for emotional support around health creates problematic patterns. If someone starts turning to AI every time they experience health anxiety, they're not developing their own capacity to tolerate uncertainty or to discriminate between symptoms requiring attention and normal body sensations. This dependency can actually worsen health anxiety over time by preventing the development of adaptive coping mechanisms. False reassurance from AI can provide psychological comfort that's actively dangerous. If you're experiencing symptoms of a serious condition, but AI tells you it's probably nothing to worry about, you feel temporarily better while your condition potentially worsens. This false comfort delays appropriate care and can result in worse outcomes. The psychological benefit of reduced anxiety is actually causing harm by interfering with appropriate health-seeking behavior. Conversely, AI might trigger or exacerbate health anxiety by presenting alarming possibilities without appropriate probability context. Someone with a tension headache might ask AI about their symptom and receive a response that mentions brain tumors as a possible cause. Even if the AI notes this is unlikely, the seed of catastrophic thinking has been planted. For people predisposed to health anxiety, AI consultations can spiral into hypochondria and excessive preoccupation with feared diseases. The lack of genuine empathy in AI responses is both a feature and a bug. AI doesn't truly understand suffering or provide authentic human connection, which is an important element of healthcare that goes beyond information transmission. People in distress need genuine empathy and human connection, not algorithmic approximations of supportive language. Relying on AI for emotional support around health might leave people's deeper needs for human connection unmet even while they feel temporarily better. The illusion of relationship with AI is psychologically complex. Some users develop feelings that their AI interactions are personal relationships, that the AI knows them and cares about them. This anthropomorphization of AI systems can create false sense of being cared for when no actual caring relationship exists. This might reduce motivation to build genuine human relationships around health support, leaving people more isolated even as they feel accompanied by AI. Solutions require thoughtful design that maximizes psychological benefits while minimizing risks. AI systems should be programmed to recognize signs of health anxiety and respond with gentle but firm guidance to seek human support. Instead of endlessly engaging with catastrophic health concerns, AI should suggest consulting healthcare providers or mental health professionals when interactions suggest problematic anxiety patterns. Embedding mental health resource links in AI responses about concerning symptoms could provide pathways to appropriate support. If someone is expressing significant health anxiety or distress, AI responses should include information about anxiety management resources, mental health hotlines, and the difference between normal concern and problematic health anxiety. Training AI models to encourage professional help when appropriate balances providing information with recognizing limitations. AI discussing health should periodically remind users that while it can provide general information, professional medical evaluation is important for personalized assessment and treatment. These reminders should be frequent enough to be effective without being so constant they become annoying and ignored. Time-based interventions might help prevent dependency. AI systems could track users who are frequently consulting about health concerns and proactively suggest that patterns of frequent checking might indicate health anxiety worth addressing. I notice you've asked about similar symptoms multiple times recently. This might reflect anxiety that could be helped by speaking with a mental health professional. The fundamental balance is respecting the genuine psychological value of AI health consultations while ensuring users understand limitations and don't use AI as a substitute for human relationships and professional care they actually need. Psychological comfort from AI is valuable when it reduces barriers to eventual appropriate care, but harmful when it substitutes for or delays that care.